So the Western North Carolina Colorectal Cancer Screening Initiative is a nonprofit with a mission of decreasing the impact of colorectal cancer in our region. Our primary function is to provide screening to low-income, uninsured patients in our communities. We also do a fair amount of community outreach, education to improve awareness for colorectal cancer, and also discuss the benefits of colon cancer screening. So colorectal cancer is the second leading cause of cancer death in North Carolina. However, it's very preventable with screening and highly curable if caught in early stages. There are significant disparities in colorectal cancer outcomes in underserved populations, especially the uninsured and low income. When we provide screening to these populations, we significantly decrease the disparities in outcomes in these residents. So this program began with one community health center in one county. Since then, we've grown to multiple community clinics in 9 counties in our region. We've screened over 3,500 uninsured low-income residents. This has represented many patients who had early cancers detected and removed for cure, but also patients who've had polyps removed before having a chance to develop colon cancer. This is very rewarding because these are good outcomes in patients who otherwise would not have had access to these preventive services. We do a lot of outreach events where we have tables set up at cultural festivals, fairs, or in churches, and this gives a chance to meet people where they're at, answer their questions, but also hear their stories. I've really enjoyed meeting people, and I'm continually surprised by how many people have had someone in their lives impacted by colorectal cancer. It also is a time to meet other community organizers, and we can strengthen our collaboration. We found when we work together, we can definitely improve our impact. Donations and fundraising are key to supporting our efforts. During this time of giving, we ask that you consider donating to the Colorectal Cancer Screening Initiative. This is money well spent on expanding screening access to underserved populations and also improving awareness of colon cancer in our community. When we work together, we can decrease the impact of colorectal cancer and ultimately save lives. These donations support not only colon cancer screening education, but care for the patient throughout the colorectal cancer continuum. This includes educating patients on preventive things they can do regarding diet, exercise, and smoking cessation that decrease the risk of getting colorectal cancer. The preventive screening can detect early cancers or remove polyps to prevent cancer. And in patients who have a cancer diagnosed, we help navigate them through the process to make sure they get the treatments that are needed.